This program is brought to you by the Georgia Neurosurgical Institute. For over 50 years, rendering neurosurgical care to patients of all social conditions, treating complicated problems involving the brain, spine, spinal cord, and peripheral nerves, endeavoring to encourage quality care, medical research, innovation, and education on a local, national, and international basis.
Good evening. My name is Joe Sam Robinson. It's my pleasure to have with us Dr. Harold Katner, who is a physician of great consequence. He's an infectious disease doctor and has studied many difficult human problems in his career. And tonight we're going to talk about coronavirus, which is the pan-epidemic that's unhinging the world. And Harold, welcome.
Thank you.
We'd maybe like to start off with some discussions about the origin of coronavirus.
Sure.
Any thoughts about that? Where did it come from? What happened?
Sure. Well, they're an interesting bunch of viruses. They were first described back in the mid to late 60s, and of course they call it the common cold, and they found a series of them. In fact, it was in '68. Because of the appearance on the electron microscope, they had this like a corona around them, and that's how it got its name. And then back about 2003, one of these viruses started this that came from, they believe, these bats that lived in Guangdong province in south.
In the south.
Southern Japan. China.
Yes.
Southwestern China, southeastern China almost. And it was these viruses this virus caused severe infection. It caused, in fact, the same pattern of illness that we see with this infection. People getting respiratory illnesses. Some of them would progress to this fulminant pneumonia, where they would get, pneumonia would cover both lungs, and they would die. Other people would be asymptomatic or very mildly ill. It tended to make the older people sicker, and the younger people didn't seem to get ill from it. So, but we were notified by China that they had discovered this virus, and the World Health Organization made an extraordinary effort to try to contain this thing. And it was contained, and so I think there was like 8,000 cases totally throughout the world. And, because some people had traveled from that area, they had spread it. But for the most part, by the end of 2004, maybe, it had disappeared.
Was there a reason? Right now, it's 2020, the world communication is much expanded, exponential change. People are moving around a lot. In China, people move around a lot. Is it just that the fortuitous circumstances that when this occurred, the international connections weren't quite as much as they are now? Well, what do you think accounted for the fact that it did pretty well in 2003?
Well, I think we were traveling. I mean, there's probably as much, it was, but it's very interesting. When this developed, the first case was probably diagnosed in Wuhan, China, which is about 1,000 miles away, I believe, in a person on December the 1st. So this was like 30 days before anybody got wind of this, and this person was not associated.
That's the present coronavirus.
Yeah, present coronavirus. So the very first cases that they made diagnosis of was this patient, and I believe from the articles I read that this person worked at that facility that studies these viruses. Anyway, so this person came down with it, got sick, and then about 10 days later, there were several other people that got ill. I think one of those may have been associated with, or quote unquote, visited this market that they keep talking about on TV. Overall, during the first month of December, when this was present in that population, about 60% of the people that had it had some sort of connection with that market. However, 40% did not. And a doctor on the 30th who eventually I think died of it, he announced it to the world. He made it public that this was something that was very serious, and he felt that everybody should know. The next day, China announced it to the world, and that's when they began to do all this work. And by that time, they knew it was a coronavirus, and they knew it was related to the SARS virus. So is very strange that it took them that long to let everybody know about it. By that time, it really started to spread. And which makes some of us think, and when I was doing research for a talk I was giving, and I noticed where this virus was, where this had happened, that's the virology lab that had been studying the SARS virus that they isolated back in 2003 from humans. And they had been at this cave in Guangdong province, and they published a paper in 2007 and in 2017. There have probably some others. And they made the comment that they found variants of the SARS virus that were very close in these bats, and they felt that was the origin of this. In fact, I can,
Yes, you have some reprints on that subject, yes.
You can see this, and the divergence, they were like 96%, similar.
Yes.
This virus is very interesting because it has a way of looking at, like when we replicate our DNA, we can proofread it. So in other words, if it makes a mistake in replicating itself, we can go back, we have enzymes that can go back and fix that. Most viruses don't, like HIV is horrific. It's a mutation machine. This thing has a way of proofreading itself, so it doesn't have the mutation rate that you see with things like HIV.
Well, that's good and bad, isn't it?
Yeah, I mean, you're right.
So, vaccine is a problem. On the other hand, sometimes if they mutate, they get less aggressive. At least possible.
Yeah, I guess except for HIV. I don't know, but you're right. So it depends on where mutations occur.
Yes.
So if you've got billions of viruses being produced today, even if it has lots and lots of mutations, some of those mutations, of course, can incapacitate the virus. Others, if they're on the code for the coding of the virus, that's a good thing for the virus because then it's going to take, like an HIV, it's going to take all these responses, antibody responses, to kind of control it. So what happens with HIV, the body kind of wears its immune system, just wears out because you've got this constant replication and this constant change in the envelope of the virus. So the body's always making new antibodies to these new forms of the virus. That's why we can't control it with antibodies. This thing, however, the mutation rate is probably far less. It still mutates, but it's far less than HIV. So again, when this thing was first described back in 2003, and then they started looking for this, they did 5 years of research looking at these bats in various places to see if they could find the origin of the SARS virus. And they did find one village, one area, one cave that had this. Now, there was lots of these coronaviruses in these bats, and these are incredibly, but this one specific area had enough variants that was similar enough to the SARS virus that hit 2003 that they would suspect that that's where it came from. And they were worried because there was a village like a kilometer and a half or so from that cave, and they were afraid that eventually they would see another outbreak of it. In fact, they even predicted a paper, a 2017 paper, that we're going to probably see this again sometime. Which meant, and in fact, I think at that point, that's when they closed down some of these markets. And if you notice, the market, quote unquote, that this came from was a seafood market. I don't know if they got coronaviruses. They got coronavirus in Wales, but I don't know if they got seafood. But that's definitely not the source of this.
Well, that's an important. You said a lot here. There's some substantial pieces of information that one could extract here. Point number one is that the origin of this terrible world affliction, and if it appears that it's likely from these horseshoe bats. Is that right?
Yeah.
And these are not your tasty bats. Is that right? The kind I'm joking slightly, but I believe that if you really want to chow down on a bat, Harold, the fruit bats are much better. They're thicker. In other words, people that eat bats, they enjoy the fruit bats more than these little bats. So this is in the Epicurean world of bat eaters. I'm joking, of course, but I hope people understand that. The Epicurean world of bat eaters, which actually happens in China, that people eat unusual things. The fruit bats are a big deal, and my understanding is, would be somewhat unusual to chow down on the horseshoe bats. They're much smaller and not as tasty as the big boy fruit bats. So, in regards to what kind of animal one might eat or obtain in one of these unusual markets, it would be not so common to get this less tasty bat.
Yeah, I mean, it was made very clear in some of these articles they do not sell bats at that market. I've been in the Philippines a lot, and they do eat the fruit bats there. And
You've seen that. Well, maybe you can speak to that. Are they tasty or that's another story.
I didn't indulge. But anyway, but yeah, so that in fact they're endangered because people were eating these things. But yes, so there was no documentation that they were selling bats at this market. And again, it's a fish market.
Right.
So why would there be bats in the fish market?
So it seems quite implausible about what's going on. And now I've heard people say maybe these bats went through another creature, and I think they've done. Let's see, what are they? Pigs, possibly. I mean, and other. In other words, there's another animal vector. So the bats hit some kind of animal. That animal gets sick, and then it's passed on through that source.
Exactly.
So is that possible?
Yeah. So in the first SARS epidemic, there was something called a civet. And I think I sent you some pictures.
Yeah, right. They're sort of a wildcat or something like that.
And there was also something called a raccoon dog that apparently had it too. And so these animals had it, but you know, everything died down after that, and they closed some of these markets. And so, but when this thing popped up, again, the closest of that virus to the prior SARS virus makes you, well, gee, were these bats migrating? That was the first thing I thought. So I looked up everything, and bats do migrate. But I couldn't find anything on that specific species migrating north, and I don't know how extensive these migrations are. So, and that, again, would be strange that you would have a virus that's so close, because this has been, 17 years since this thing was first described. What they did at this virology lab, though, they were taking these bats and bringing them to the lab, and they were studying, they were doing anal cultures of their, looking for this virus, and they discovered it. And they did extensive research. They analyzed the viruses, as you can see from the articles. I mean, they broke down the DNA of these things, and that's how they discovered that this was probably, probably where it came from.
Now, the genome, one of the things that impressed me about Chinese science is they got the genome out very quickly, much quicker than anyone imagined. Is that because they had a head start on this? Normally, you wouldn't. Normally, I mean, in other words, the lab had been immersed in this, and they were able to get the human genome out pretty quick. And so, for that reason, that's really jump-started vaccination plans.
Yeah, I mean, that's a good way to put it. I mean, unless they had a good idea what it was to begin with.
Well, that's my point. In other words, making the case that possibly, and I think some of the articles, no one imagines there was any kind of, they weren't trying to weaponize this, or there's no plan to this is going to be a super duper thing. It was a sort of a sorcerer's apprentice kind of thing about trying to probe this unusual, I guess, outbreak. Maybe we can, the idea is, the thrust of their research was to determine where the initial infection came from. It's pretty arcane, the initial SARS outbreak. Yeah. That was the reason they were pursuing this for a decade or two.
That's right. So when they saw what the initial cases were, that's why they focused on this area. And then when they began to, sequence the viruses in various animals and the ones that were infected, and then realized there was all this coronavirus in these bat populations, that's where they thought, well, let's go look for the bat populations. We knew the bats were there. We knew that's where the first cases came from. And again, they made a concerted effort to describe this. And they did it purposely because they were scared, I think, from what I'm reading, that this is going to happen again. And so, I don't think anybody did anything wrong. I think there was, when you read some of the investigations that occurred, the government, I think, was funding this lab to begin with, in part. I don't know how much was coming out of the United States, but
was the U.S. funding the lab to some degree?
Yeah, to some degree.
Were. So actually, I think that's not a commonly known fact, is it? Yeah. That the U.S., for some reason, was putting taxpayer money into the lab in Wuhan.
Yeah,
that's interesting.
Well, I think they were concerned about the potential.
Of course. So they thought it might be a good idea to see what, and there have been interest. Substantial interest in many circles about pan epidemics, and so they were like, maybe we can understand more about the origin of SARS.
Sure, and you know, the thing about this, though, so they had congressmen had gone to, I guess there was some people that had gone there to review the lab.
Yes.
And there were some deficits, and so there was these cables that the Washington Post dug up. They were not, I forgot how they worded it. I mean, they were classified, but not top secret.
Yes.
And he was able to get copies of these, and there were concerns at the way the lab was being run. Were they taking the proper precautions to prevent this virus from escaping the lab? And again, this is the Washington Post. It was not
yes.
It was not some tabloid. And again, that came out the day after I presented this information at we have a infectious disease meeting once every Monday.
Yes.
And you know, when I looked at this, I said, "My God, this is really screwy, and it's too close to make it."
Yes.
It has to be considered, I think. It has to. There's a possibility this came from this lab and not from something.
And in general, just right, you know, what the issue about the fact this happened, we need to learn from the experience, understand what occurred, and then put some substantial preventive precautions out there in the world to protect our species. So obviously, understanding how this terrible disaster occurred is an issue of consequence. And so the initial story on the street, so to speak, was these were the origin of this were from one of these exotic food markets. I guess I would phrase it that way. I've been to China, as probably you have too, several times, and just the extraordinary nature's cornucopias there. Every kind of creature in the world that could possibly be consumed. They eat, I mean, you name it. I won't go through the number of cats, dogs, rats, whatever, cockroaches, whatever. I mean, anything. And there's a whole Chinese culture, and there are people that are Epicureans, and kind of like the ancient Romans, who ate, you know, all kinds of strange things, or medieval Europeans. That was a bit of prestige to eat peacocks or whatever. In any event, the idea was this was the case, and that would be what we should close down. So it would be incumbent on the Chinese government to close all these. But it turns out that there may be another story here, the one you're bringing up, which is this was one of those sources apprentice kind of thing, where a mistake was made in a lab, not a willful one, but something got out. Now, my understanding is there are different levels of security in labs, and maybe the CDC, whatever. The Ebola's in a 4. I mean, I passed my knowledge 4, and apparently this lab was a 2. So, or something, or at least they were concerned it was such a low protective.
Yeah, well, it may have operated at a 2. It's supposed to be a 4 also, if I'm not mistaken. This was supposed to be on the same level as, this is like the CDC lab of China.
Right, and apparently the letters said, we think this is on the protections on much less of they're not good enough.
So when they brought this up in these cables, and this is, I think, 2015, this is before any of this happened.
Yes.
Yeah, it made it very concerning. Did someone get infected with this thing from that lab and leave the lab with it? Because, again, they were doing ongoing research with this. I mean, again, the most recent paper was 2017. There may be others I'm going to have a chance to look for. But, so, you know, and things like that happen. Like you know, I'm from Louisiana. We had the Carville, and they were studying leprosy. They infected these armadillos with leprosy. Well,
now.
Yeah. So now, you know, Dr. Stevens had a case report of he saw a case of leprosy here, and they got it from an armadillo.
They're out there, aren't they?
Yeah.
Be cautious about eating them.
That's right. So they went back and did very careful genetic evaluation of these armadillos, Mycobacterium leprae, and sure enough, they'd come from Carville. So these things had escaped with the leprosy and infected other members of its species, and now it's already here in Georgia. So things like that happen. And of course, you had that anthrax, which probably came from the person purposely, you know, during 9/11, who was a scientist who committed suicide. And there's a lot of suspicion that, based on the strain of the anthrax that was being spread around, he was doing this purposely. So you've got people like that too.
Well, we have a lot of issues out there to protect our 8 billion inhabitants of the planet. Yeah. One of them is, well, we could go back to this. understanding what happens when it happens. And apparently, one of the distressing issues, or the way the Chinese government has responded to this, and then we get into the American political story. But I think to me, it would be reasonable. What I know of China is it's sort of a Mandarin-centered thing with the emperor and top-down arrangements. Harmony is a big deal. Control is a big deal. 1.4 billion people. When China has trouble, it's when the emperor is not strong. So the center really, really controls things. If you're a minion out in the provinces, the last thing you want to do is disturb anyone. And so the downstream bureaucracy would presumably not be inclined to report anything. They would try and basically, at a low level, stop this problem from going upstream where they could get into some trouble. And then once these facts were out there, there was confusion about what was causing it. It became the national government's best interest, the way they construed it, would be to deflect blame. And then apparently all kinds of things have been closed out here. They closed out different, I guess, people looking over their circumstances. They've taken anything, I think, off the internet. There are any papers that might be involved in the origin of what occurred here, with the idea of damage control. And the other thing of consequence here is, and this we get into the American political story, if in fact there was some kind of, knavery is a strong word, but possible knavery between the World Health Organization and the Chinese government about how to downplay this. And indeed, politicians, it's in their interest pretty much to downplay things. I mean, no surprise. The alarmists, if you're a decision maker, people are constantly coming to you. The dam is going to break, a comet will hit the Earth, the nuclear reactor will blow up. Just constant stories about pretending apocalyptic catastrophes are constantly coming forward. I'm sure the World Health Organization gets stuff like this. But the question would be, number one, understanding what transpired, and then number two, and to me, this is the important part of it. I mean, to me, if in fact it escaped, I mean, okay, it just happened. Yeah. But is there other places in the world that have dangers like this? How can we get to the bottom of things quickly? Is the World Health Organization an adequate I guess, structure to do these things? Right. And it also, I would say, brings up the need to have a world arrangement present because of the amount of transportation. People are moving back and forth, how easily these viruses can spread, or any kind of infectious disease. Having some kind of world control apparatus out there would be a necessity. Do you have any comments on that? I mean,
I'm very interested now in going back and looking at exactly what happened with the 2003 epidemic, because China, again, just reviews, not the articles yet, and I'll get to that, but hopefully. But it looks like they notified the World Health Organization very quickly, and they stepped in, and they did what they're supposed to do, so they're able to control this thing. And so here it looks like they didn't tell anybody for 30 days after this thing was present. So, in fact, as I said, the doctor that first broke the news, he was squashed. And there was another one recently that has disappeared, that she also made some comments about this, and I haven't found the article about her yet. But it's scary because, I think you can only work with what you've got. And if the World Health Organization didn't have the information, and this thing was not, the
statistics being presented there were not, they were downplaying the danger. So the World Health Organization said, well, these facts are not so bad, if these are the facts.
Yeah, so I have a feeling that it got out of hand before any of us knew. And again, it makes me also think, why would they hide this? Unless, again, there was a mistake made and this thing got out, and which again is counterintuitive, because you think, well, something happened on a lab, and this got out, and we need to address it really fast, but they didn't do that, and so this is very disturbing. again, I don't blame the World Health Organization because they could handle the MERS epidemic.
Yes,
They handled that.
Right.
They handled this one pretty well. Now Trump doesn't even want to fund them anymore. We need them more than anything.
Well, that's a big question here.
Yeah.
Maybe we can sail the ship. I mean, making a few comments maybe about China and bureaucracies. I mean, to me, I mean, with the Chinese history, would certainly, I'm sure there are stories about just not telling the emperor what's up here. You're out in somewhere, and the emperor don't send this to Beijing, keep this here. And you could say in Russia, the Potemkin villages, the Empress Katner is coming, and will disguise everything from the center. That's probably a bureaucratic difficulty everywhere. I mean, it may well be something that's happening in the U.S. That it's not being communicated to appropriate authority. I mean, I would imagine that's a common story, isn't it?
Yeah, I mean,
anywhere in medical schools and any institution. I mean, something happens. Well, let's not overplay it.
Well, yeah, I agree. I like when Trump came on and said we're going to have testing for everybody. I mean, I was exposed to a case, and I had to be in quarantine for 7 days, and I got sick right after I got the exposure.
Was this coronavirus?
Yeah, it was coronavirus.
So you've been infected.
Well,
am I safe here tonight, Harold? I'm pretty sanguine. I mean, I'll be okay.
But no,
You were exposed. Tell me about that.
Yeah, so the very first week that the epidemic hit here, I saw one of the very first cases at the medical center.
Yes.
And I think there was 3 cases that day. I think it was Stephen saw one, I saw 1 or 2, and I saw the other one. And but I'd been taking care of a lady for about 2 weeks prior to this, who came with Haemophilus influenza, bacteremia, and pneumonia.
Yes.
So, and of course, everybody was telling us you can't get 2 things at the same time with this, even though that was totally garbage. And so we didn't even look for that. Yes. She got better. Right. She got worse, and then she was getting a bunch of fluid. I thought they flooded her lungs again, because she was albumin was so low. So then the hospital says, let's check her for COVID. I said, I don't think she's got COVID. Well, lo and behold, she had COVID.
Wow.
And then, so that meant there's like 9 doctors exposed, maybe 12 or more nurses are exposed. And I got sick right after that. So, but the same week, I got exposed to metapneumovirus, 2 other coronaviruses, and a rhinovirus, adenovirus. So, and we know
well, your immune system must lift weights. I mean,
but I got something. But here I was with this thing. So so it took an hour late to get a test done. I got it the next day, but it was 7 days before I got the results back. My wife's a physician, and so she couldn't go to work because her partners didn't want her to come in there exposing people. So I got 2 kids at home, so I'm saying, Jesus, what has happened here? And so I was waiting to...
Right, that was pretty stressful, wasn't it? And you were sick, and you just toughed it out at home.
Well, that's all you could do, and then hope you don't have to self-isolate.
One of the issues is the rapidity of testing, and also the accuracy of testing. That turns out to be a substantial deal here.
Yeah, we had another patient who admitted he was in Albany. The patient, he or she was in Albany, or they were in Albany. And they ended up testing positive in Albany. They didn't tell us. They sent the patient to us. They did a test here, and that test was negative. So here everybody's working with this patient with a negative test here. Finally, somebody calls Albany to get the results. They didn't realize it had been tested already, and there's a positive test. Now, did that person, quote unquote, lose that virus during a period of time? Unlikely. It was just a few days, and the patient was sick when they got here. So there's the probability that the test was either wrong, it could have been a false, probably most likely a false negative test here, and it was the way the swab was taken, it was sampling error, who knows? But that's the problem. They had one patient, I think they tested them 5 times, they really thought they had COVID. On the 5th time, it was positive.
There's so many conversations about that. We've said some interchange about how the false negatives that are appearing with the routine swab tests that are out there. I've also heard that different kits or different, apparatuses have greater sensitivity. Some have comments about that. In other words, can we believe a negative test?
I don't think you can, and if the picture fits it, the picture fits it. As I said, there were sometimes they've had a test multiple times to get a positive test. they've had people that I mentioned earlier that they've had a negative test here and there was a positive test at the referral hospital. So you can't use that. In fact, I got burned, as I said, with the case I was exposed to because we didn't test initially. And so now I'm taking precautions with everybody. I mean, I wear a mask every patient I see.
Is that a good idea, Harold? You know, the story is right now, how are we going to deal with this situation? And should it just be pretty much a universal arrangement? It shouldn't pretty much everyone have a mask? And could we get people back to work sooner and schools sooner? Does that really drop the transmissibility of paramount?
Oh, it does. It really decreases the transmissibility of the virus. I mean, it can live on a surface for a while, but whether fomites can really transmit it or not, we don't know. Right now, if you've got a mask, in fact, it lives on a mask, the surface of a mask. We're supposed to decontaminate the mask every time we go in and out because we have to keep our mask now for a week because we don't have enough masks.
Is that right?
Yeah. And
so do you have one of the N95 masks?
I do.
So that's the mask you routinely. Well, do you have one? Let's take a look at it. Let's examine this mask. And
so
what is good about this mask that's not present, and what are the dangers that you have with this mask, right?
Well, as you can see, it's kind of messed up on the surface because I have to clean it every time I enter a patient's room.
Oh, really? How do you clean that?
Well, in the COVID patients, this is when I clean it. The COVID patients, there's this very strong disinfectant. You can't use it without gloves on. And when you go in, you have to wear a shield, a mask, a gown. You double glove, and you have one set of gloves that they're sort of over the gown that you wear. Now we run out of gowns. So the last one last one I saw is the gown inside the room. So you put your first set of gloves before you go into the room, then you put the gown on, then you put the second set of gloves on top of that, and then you have to walk in with the mask on already and the shield. You examine the patient, then before you leave the room, you take off the gown with that first set of gloves. Then you take this very strong disinfectant and you wash off your gloves. You leave the room, you wash off the shield, and then you also wash off the mask, and that's when it's kind of ratty on the outside.
Yes.
Now, and you try not to breathe the stuff in, it's really, really toxic. So, and then we used to get a new mask every time we go in. We used to have a new gown every time we went in. In fact, now there's so few gowns. I just saw a patient with one of these really, really resistant Staph aureus infections. They used to make us gown up for them.
Oh, yes.
Now,
don't worry.
No need for a gown, so just wear gloves. So, but that's how desperate we are to have enough.
Well, now, Harold, I'm going to squeal. I mean, I'm going to squeal to the American people or whoever's out there. Well, this is a big deal here. If we're going to overcome all the issues that we face, we need to get a national step up here. I'm hearing reports that, we're doing this or we're doing that, but just the requirements are pretty extraordinary. If we can produce, B-29s to bomb Tokyo or whatever, I don't know, what are some more planes? I don't know, Sabre jets to take on North Korea. Mm-hmm. We can, Sherman tanks. We really need to just get chomped up here. I mean, this is a big deal, and my understanding is that a lot of the equipment that we receive is from overseas, particularly China. And I've also heard the Chinese are volunteering to send us what we need. Do you think that the apparatus is working well enough to get you what you need here?
Well, I don't know, and I think we're in a lot better shape than other places are. In fact, we're taking in patients from other communities because we have the capacity at this point. I think they now have 3 units that they have set aside for COVID. And one of the units has a COVID suspect and then the COVID patients that are sick. As soon as the patients get better, we try to get them home.
Yes.
And, but of course, the ones that are sick enough to be on the ventilator or close to being on the ventilator, we have to keep them.
Now, is there one of the big things that are discussed a lot in national media, ventilator shortages. And the government has said, well, we've taken care of that. I don't believe there's such a shortage here, or is there? I mean, what about our ventilator situation here?
Well, again, the hospital's being very quiet about this.
Well, Harold, you don't have to say. Go ahead. It's all right.
So But
I'll talk to them if you get in trouble.
okay. But I don't know because they're being so quiet about it. So now we have, I think, on the 7th floor we have a unit. We have one on the 4th floor, one on the 3rd floor. So since I only see the ones that get consulted on, and I can't go around snooping to see who else has it, obviously. I don't know how many of those beds are occupied at one time. I do know we've had people coming in from other communities, even in Albany.
Particularly Albany. Albany's been a real crisis point, isn't it?
So
It
now the governor, I think, just recently stated that we're going to, or at least they estimated we're going to have a shortage, I think, by the end of April.
Ventilators.
Ventilators. Not the quantity that they once thought they would be, but
still. The numbers have come down a lot, have they not? In other words, the idea that we're going to have this 2 million deaths in the United States, or
100,000.
Well, I mean, whatever.
2 million cases, I think.
I've heard huge numbers, and then it's dropped to 100,000, 200,000. Those numbers have come down, have they not, substantially?
Well, because we're practicing social justice.
Right, and so right now, I mean, presumably that everyone is aware, I'm sure this is the case, everyone in the medical community and in the political community, and they're aware of needing what we need, and presumably we have an apparatus in place to obtain it. Yeah. Is that a fair statement? I mean, people are not just ignoring the situation.
Oh, no. I mean, you've got some people that break the law and do crazy things, but for the most part, most people are being very careful. I think
what do you mean by breaking the law?
Well, you've seen some of these churches that still held their church services without.
So there are some dangers from that point.
Yeah, you've got people doing that, and you have some people just don't seem to understand. I think it's sinking in now, and I think people are being a lot more careful, and they keep showing all these people that are dying on TV, which I think helps.
That has an impact, does it not?
And what I'm hoping is if we do contain this thing, maybe they'll be opening up some businesses where people can practice these social distancing, and they can. A lot of my friends who are still working, like at Publix and Kroger and these sorts of places, they're being very careful with them, and now all of them have to wear masks, and all of them have to wear gloves, and they have to change their gloves. So I had one of my patients works in Publix, and they've got their employees, trained to a T on how to avoid this.
Yes.
And so you can run a business and prevent your employees from getting it. Nobody in his store has gotten this, so that's pretty impressive. Yeah. And that may be their solution: is continue social distancing, teach all these businesses how to deal with this, and then get back up to speed.
Well, now, Harold, maybe I could ask this question. Obviously, there have been substantial numbers of deaths. I think over 20,000 in the U.S., over 100,000 worldwide. So a lot of deaths are out there. The question is, how deadly is this? And the role the immune system plays in this. What is the denominator out there? And I've heard it said that because there's such a paucity of testing, that many, many, many people may have been exposed to the virus and been quite asymptomatic, no problems. And in general, younger people are pretty much spared from this.
Exactly.
And comments about that, or the people, would it be better to quarantine people at risk? Antibody testing, maybe that could get you free on this. And
it's a, again, it's hard to predict who's going to get sick. So we had a nurse practitioner down, and I work in a clinic down in Valdosta, and that covers the Tifton Health District. Right. And one of our nurse practitioners down there got COVID.
Yes.
And this guy's in his 30s, and he ends up in the unit in Albany, and he's from Albany, and just about died from it. But he's healthy. He's a 34-year-old person. So now we had some of the ones I saw at the hospital were relatively young, and they still got very, very ill. So, now the kid issue is different. But we've had at least 2 at the hospital in the ICU, at the pediatric ICU with COVID. They were teenagers, and they weren't the really young kids.
Right.
And so I think, can you open up the schools as you mentioned before the program? I don't know. I think, as you point out, the medical legal system here would be very, very a major issue. If one kid got sick, everything is over with. So I think they're going to, from these schools, there's a medical legal issue with these schools. They're going to probably keep them shut down.
Maybe this begs the question, what do we not know about our immune system? When we confront this, I mean, I think the public generally says, well, they know everything about everything. And isn't it why some people would be struck down and others spared, and a healthy young person? Or what happens to your immune system when you get older? I mean, is there any way to actually check your antibody response and say, well, you're really at risk, or you're really not at risk, or any comments on this?
So I think in children, one of the thoughts there's an ACE inhibitor, there's an ACE receptor that is present. There's more of these receptors in adults than there are in kids. And this utilizes this ACE.
In the lungs a lot.
Yeah. It utilizes this to attach to the human lungs.
So when there's little spikes on the coronavirus, women's lungs, there's a little place they can hook up on.
Yeah, and children have less of these receptors than adults do. That's one theory why the kids aren't getting sick like we are. So that's one thing. The antibody test, again, would be very helpful, because if the antibodies really are protecting us, if we get it, then, my God, if we knew who had it, we could let them be on the front lines of managing these cases, number one. So that would help prevent other people who are exposed from getting it. That'd be number one. Then also, if this thing is spread through a population, and you know the antibody status, if there's enough herd immunity in that population, well, maybe you don't need to have that group of people be so obsessed about wearing masks and everything all the time. That'd be difficult. But in Korea, they were testing 10,000 people a day and in some of these areas. And so that's how we realized that the mortality rate was probably much lower than we thought, because you knew who had it. You saw who all the asymptomatic people that had it. And so here again, if you had the right testing, you could test everybody in the community, you would get a good idea of where your potential next epidemic is going to pop up, who needs maybe to be more aggressive in trying to prevent this thing from happening there, what groups of people that may want to be isolated from the rest of the country for a while until we get a vaccine or we get a medication that we know works. So there's a lot of things that we could do if we had better testing.
Well, can I squeal briefly once again?
Sure.
I made the comment, well, all right, if this is a national crisis, as I believe it to be, and a world crisis, it's certainly time to get out there and play football. So when I'd say 350 million people approaching that number in the United States, and when I hear politicians bragging that, well, we're going to have 100,000 tests next week, that's utterly inadequate. Totally 100% inadequate.
You're right.
That is absolutely. I want to hear someone say, I plan to have 50 million tests available next month.
Yeah.
That's the kind of story I want to hear. I want to hear someone say, I'm calling a special meeting of whoever the hell is out there, and we're going to get those tests, and we're going to work 24 hours a day until they're obtained. And that sort of national emphasis needs to take place. Instead, Harold, if I can speak slightly about the American political process, it appears the major thing going on here is a lot of bickering and blame arrangements that's very inappropriate for the American people. That would be my thought about it. Yeah. Harold, do you have, I know that your schedule is busy here, do you have any comments out there about social distancing? What can we do? How can we respond to this? What do we need to do at this time?
Well, I think the mask is a very valuable tool, and even these cloth masks will reduce the transmission rate. There's some very good articles now, in fact, on that, and they even show how many droplets occur using just a regular old surgical mask or a cloth mask. And so I think 6 feet minimum would be the ideal as well. I don't know if you saw the picture I sent you of the guy sneezing.
Yes, 12 feet.
It was like 26 feet.
Okay, it's much longer than if you sneeze, it's pretty devastating.
The initial studies done on droplet precautions and stuff was done usually in 1897 and the 1930s.
Right.
And the woman who did this study I mean, she said, we have to update this. So she did some new studies on this and realized, my God, these droplets are going a lot further than you can imagine. And so potential for transmission of this, if people are sneezing and coughing on each other, is much higher. So
Harold, a law requiring mask in public places.
I think that would be
Do you think that's an appropriate thing?
That's an appropriate
If the legislature was in session, I think there might be a problem. Guess what it is? I think they're a little timid to show up there. Right. But if we need some, and so in many ways, this has been passed on to the executives. I mean, so the executives have to propagate something. I think we'll have a discussion about that at another point. But that's an issue. What do we do to really do whatever we need to do in these circumstances?
But I think an aggressive, I'm really amazed at Governor Cuomo, how he organized things and structured things and how open he was about the cases and, what had to be done. And you need someone like that leading a community or a state to, especially in a place like that. I'm from New Orleans, so I mean, my family's there, and they're scared to death because this Mardi Gras thing spread this thing everywhere.
Did they attend the Mardi Gras? Were they out there?
Oh, yeah. But
that's bad.
None of them have gotten sick from it. But, just to be living in that environment and listening to them, what they have to go through every day is scary. And my mother's 89 years old, and, she's and it's just the people she was exposed to, some of them were at that nursing home.
Yes.
So it was just that had that big outbreak. So, everybody's waiting and watching and hoping that nobody's going to get sick from this in the family because of the amount.
Sure.
Of this
it's pretty deadly if you're an older sick person. Now, I've heard this, and I know it's about time to conclude here, with sometimes medicine for hypertension plays some kind of role in these receptors. Any thoughts about hypertension as one of the morbidities that might play a role?
ACE inhibitors, because of the ACE receptors, and honestly, I haven't delved into that too much, but there are other articles out there on that topic, and whether that has an impact at all on the prognosis of the patient or the patient acquiring it. And one other thing, real quick, this Plaquenil, the hydroxychloroquine they're talking about?
Yes. Comment. Good. That's talking
about. Two patients have been admitted on hydroxychloroquine. One had proven COVID. I don't know what the other one's status is now, but obviously it wasn't protecting them. They were on. They were on it for lupus.
Right.
And so, and the data in these studies was horrific. I mean, the way the studies were designed, that the ones that were two published out of the French group,
they were quite nutty. They weren't up to normal standard.
No. They looked at. It was really bad, and no clinical data at all in either one of these papers. So until they do the double-blind controlled trials, we still don't know. Now the antibodies, the serum that they're giving from people that have had it, and
yes.
people that, again, anecdotally it looks good, but who knows? We just don't know because some people get.
For the general public, I mean, the idea is it's just the way we do things in medicine. I'm here to stay. We really have to be pretty tough about what works and what doesn't because the causality is so complicated.
Yes.
So many things are involved in this. Each person is different. Trying to find our way through the forest is tough. And we have to be very cautious about just bogus cures that give people false ideas. Well, all right, Harold.
Okay.
I know you'd be on your way, but firstly, let me congratulate you for your efforts here, and obviously you're a very heroic person, and I mean, you're a fine example of what a physician should be. I'll just say that, and I wish you well. And we'll come back at any point. Anything you feel like the public needs to know, this will be a good venue for you. Once again, I won't shake hands with you, Harold, and I'll try to stay as far. But anyway, thank you so much, and we'll have you back. Thanks for your help.
This program is brought to you by the Georgia Neurosurgical Institute. For over 50 years, rendering neurosurgical care to patients of all social conditions, treating complicated problems involving the brain, spine, spinal cord, and peripheral nerves, endeavoring to encourage quality care, medical research, innovation, and education on a local, national, and international basis.